Afternoon, good evening. All right, sorry, that's starting. So good morning, good afternoon, and good evening, everyone, my fellow peers and allies from all around the world. I'm Ashwin, and I'm delighted to welcome us all to the 4th Global Recovery Dialogue. I'm standing in today for our one and only beloved Nancy Dudley, who's actually both the Director of Communications and also the Executive Committee member of the Global Recovery Dialogue. Today is a very special dialogue because we are finally able to provide Spanish translation for our Latin American colleagues. So I'm really happy to see all of you here with us today. It's been something we have been working on since we started with the dialogues in January. So yeah, we really want to thank you all for doing the translation. So there is a globe function at the bottom of your screen. So clicking on that will give you the option to either join in English or in the Spanish channel. So a little bit about our global recovery dialogues before we begin. So these dialogues are an initiative to promote recovery in our communities and also a bit to stimulate discussions and share our experiences both as peers and allies in recovery. Now, these dialogues are also part of a soft launch leading up to the official launch of our network in June this year at the ISSUP Conference, The Art of Healing in Greece. So I really hope that we'll see everyone, with a bit of relief from all the online Zoom meetings. It'll be great to see everyone at Greece say hello and shake our hands. So our Global Recovery Dialogue, our Global Recovery Network is a platform to promote a universal understanding of recovery. And we are hoping to do this through the unification, professionalization, and provision of support. So let's get on with our dialogue today. As always, I'm pleased to welcome Michael Botticelli, who is our facilitator for today. Michael is the chair of the Global Recovery Network and the former director of the Office of National Drug Control Policy under President Barack Obama. Our presenter today is from South Africa. Warren Cornelius is a recovery ally and community activist. He's been doing lots of good work on promoting recovery for more than a decade now. He's also the Deputy Country Coordinator for ICUDDR and also in charge of prevention and recovery programs for ITTC South Africa. So Warren will be talking on the topic stigma and inside job. It's a very important topic. We speak a lot about stigma, but sometimes we don't realize that there are multiple levels to stigma. So Warren will be sort of unpacking that for us today. As always, we will begin with a short presentation before we open the floor to a discussion that Michael would be facilitating. So I would also like to remind everyone that to speak slowly today so as to help our translators best translate. So with that, I'd like to invite Warren, and the floor is all yours.
Thank you, Ashwin. Let me just get started with the presentation. Trying to get it onto a slideshow. There we go. Okay. So my name is Warren Cornelius, and I wear different hats, and hopefully you guys will learn more about me through my presentation today on reducing stigma. So I've tried to include the Spanish translations of the presentation headings, but I've used Google Translate, so please forgive me if they're not correct. So before I get started, I'd like to point out that I'll make my slides available, and also there's a recording of this show for people afterwards. So let's get started. So I'll give you a bit of background about South Africa. South Africa is the most unequal country in the world. So this image clearly illustrates the divide that exists in South Africa. And this divide exists for access and availability of services as well. However, stigma and low mental health literacy are the main reasons for people not seeking treatment on both sides of this road. So let's define stigma. So stigma is really a strong lack of respect for a person or a group of people that involves labeling, stereotyping, distinguishing or othering people, and discriminating. There are three distinct forms of stigma. So enacted or experienced stigma really refers to the extent to which people with a mental illness are actually discriminated against by others because they have or are thought to have a mental disorder. Secondly, an anticipated or experienced stigma is the degree to which individuals with a mental illness anticipate they will experience prejudice and discrimination. And thirdly, internalized or self-stigma is the degree to which people or individuals with a mental illness really endorse the negative beliefs and feelings associated with having a mental disorder. So enacted or experienced stigma, there are various manifestations of enacted stigma, clinical or medical level, where healthcare providers discriminate against service users in addiction, as they believe it might be a choice, they are criminals or they are violent, etc. And this really results in poor treatment and referrals for these service users. And public attitude or public policy level, currently in South Africa, substance use disorders are framed as a social ill and a criminal justice issue that drives gender-based violence, interpersonal violence, and HIV, etc., rather than dealing with it as a health issue. So as such, resources are directed away from addictions care, and this really impacts poorer people more, who in South Africa are people of color. On the media level, where the media perpetuates stigma by using highly stigmatizing language and images, so that they reinforce negative public beliefs, often reporting, linking substance users to crime. And then individual, familial, and community level, where people or family or community members openly share their negative beliefs and stigmatizing and discriminatory language. So for the purpose of this presentation, and to save time, I'll be touching on all of these manifestations, but focusing mainly on the level that I'm most passionate about, which is really the community and individual level. So anticipated and self-stigma are a direct consequence of enacted or experienced stigma. So these anticipated or internalized stigmas are associated with poor or no help seeking, diminished self-esteem, lower quality of life, guilt and shame, and isolation and disconnection. So I want to chat about mental health literacy because I'm going to be speaking about this in all the rest of the presentation. So the term mental health literacy was first coined by Anthony Jorm and colleagues and is defined as the knowledge and beliefs about the mental illness that aid their recognition, management, or prevention. So mental health literacy has the potential to influence help-seeking behavior and hold serious implications for adherence to treatment. So all the strategies that I employ in reducing stigma includes improving people's mental health literacy around substance use conditions. So let's speak about reducing stigma on a media level. Media plays a huge role in perpetuating stigma, but they can play an equally huge role in reducing stigma. So in 2020, during COVID, I conceived an idea of improving the mental health literacy of ordinary South Africans using the media. I produced a TV show called Breaking the Cycle. It was a show for people who use substances and for those who are directly or indirectly affected by addiction. And it was the first and only TV show in South Africa to address substance use. So the aim of the show was to empower users and their loved ones to make informed choices about the prevention, treatment, and recovery of substance use disorders. So we really married the lived experiences of users and their families with evidence-based solutions. So I'm not going to play the video right now, but what we really found, the whole basis of this TV show was really to meet people where they're at in terms of the language that they use, the understanding, and the setting. So, for example, we want to change people's usage of destigmatizing language but we need to meet them where they're at and what they understand, the current language that they're using. So it was really to integrate the new language with the existing language to make people who have less understanding of what substance use is all about and stigma. And then the benefit of media is really meeting people where they're at in terms of their setting. So in their living rooms, yeah. So although this was the highest rated TV show on that channel while we aired this pilot season, we couldn't carry on with the program because of stigma. Private companies wouldn't advertise around this program around substance use disorders. We couldn't find funding for anybody who's interested in funding the production of this either. So it plays a huge role in even how we're framing substance use disorders in the media. So practical steps that I suppose everybody could take is really sharing information and knowledge on substance use disorders and stigma with local newspapers and radio and TV channels. So reducing stigma on a clinical or medical level. In South Africa, only 2 out of 26 public universities in the country offer any specialized addiction science training. So it's leading to healthcare providers relying on their own understanding of substance use conditions, which is not based in science. One strategy we're employing as ICUDDR South Africa is assisting South African universities with addiction science curriculum development, implementation, and the development of academic staff competencies in the addictions field, which will have a huge, profound impact on reducing stigma on the clinical and medical level. Reducing stigma on a policy attitude or policy, public attitude or policy level. So through the ITTC South Africa, we've made great strides in influencing policy by co-hosting the last national summit on substance abuse and being central in the provincial dialogue in reviewing the country's drug master plan. And it's really the policy that governs the way substance use is treated in South Africa. And my role within the ITTC, it allows me to do community engagements where I do presentations at schools and other community settings, improving the mental health literacy around substance use conditions. So this is my favorite part of it all, reducing stigma on a community level, but this is also a public attitude. So communities in South Africa are plagued by crime, and crime is strongly associated with substance use, similarly portrayed in the media, which is a strong driver of stigma in our communities. So what we've done is I, together with a few other community members, established a civic organization to really meet the needs of the community.
And Warren having some challenges with the network. Warren, right? Warren, you're on mute.
Yeah.
Right. Warren, you're still on mute.
Can you hear me?
Yes.
Yes, we can hear you now.
Is my still screen sharing?
No, not yet. You'll need to share the screen again.
Okay, just hold a second. Okay. So I think I left off by the civic organizations. Is that the last you heard of me? Okay, so my role is in the civic organization as the. Can you hear me?
Mm-hmm.
Yeah. So my role within the civic organization as the social development project manager.
Yeah, but you're not on slideshow.
Is it not in the slideshow mode?
No, it's
let me just try and sort it out.
We're just talking about, yeah, Murphy's Law yesterday. What can go wrong will go wrong.
Yeah, that's Murphy's Law. Maybe I should end the slideshow and just restart it again.
Yeah.
Okay, let's try it again. Uh, okay, can you see it now?
Yes.
Yes,
Okay,
now
cool.
we're good. We're on.
Okay. Okay, so my role within the civic organization as a social development project manager allows me to be a guide on the side for community members seeking help with their substance use and other mental health conditions. And that really includes having just conversations with people and being the first point of call on people's help-seeking pathways and referring them to the necessary services. So the civic organization really incorporated the Neighborhood Watch, who are a group of residents who patrol streets at night. And we've made great strides in changing the way Neighborhood Watch responds to crime through improving their mental health literacy. So previously, what would happen is a Neighborhood Watch who was on patrol would apprehend perpetrators of crimes and really just beat them up and drop them at the nearest police station. But what's happening at the moment is so they're finding out what are these perpetrators, are they struggling with substance use, what's going on for them, and we work together in getting them referrals either to treatment or sometimes perhaps it is the criminal justice system that they need to be referred to. But there is a massive change in the way people are being apprehended and referred. So I also serve on the so this is me and the civic organization members, and this is me in the ward committee. So I also serve on the ward committee where I represent the community and participate in the allocation of ward budgets with a ward councillor. And I just seen how stigma impacts budget allocations on a very localized level and community level. For example, a ward councillor would rather spend money on putting up more fencing, build higher walls, more policing, more law enforcement, but no money would be spent on social development and the upliftment of people. And I could see how that impacts. So we've made quite good strides there as well in terms of having start implementing social development projects within our communities. So last October, I organized a community open day and invited all community stakeholders to present on substance use and stigma. And I facilitated a community dialogue on the topic. I'm not too sure this is going to play or interfere with the internet connection, but I'm going to try it anyway and just hope for the best. I'm going to play a short clip of this community stakeholders that were present, and hopefully you can see there's no audio to it, but you can see here traffic services were present, the Metro Police were present, law enforcement we got to come in. This was the City of Cape Town stall that they had. The busiest stall was the tuck shop. This was the College of Cape Town here. Some other organization, Stats SA were here, and this is where I did my presentation over here. So, you know what was a great thing that came out of this is really to find it to find it just engage with these stakeholders, specifically law enforcement, I found, and what is their understanding of addiction and the impact of their stigma. And they walked away with, like, we tried to connect the dots, and they walked away with a better understanding of addiction and how their stigma impacts their roles in their work, etc. But what is more important is that these stakeholders not only use the knowledge or their mental health literacy now in their professional lives, but it's carried over into their families, into their homes, and the communities that they live. So it has far-reaching effects. So I suppose practical steps that anyone can take is really to find out if they have a civic organization in your community, or start one. And again, sharing knowledge with community stakeholders is vital. So again, on community level. So myself and a group of volunteers organized the Recovery Walk Cape Town. It's an annual event, an inclusive event to make recovery visible, to celebrate recovery, and to create a safe environment supportive to recovery and challenge the associated stigma and social exclusion. So we've created a recovery movement. It's really a coalition of peers and allies, grassroots organizations, treatment facilities, etc., who come together for a common goal. So we're getting closer to having city and government officials join us. This is our 10th year this year of this recovery movement, and we've not had any city officials or government officials join us as yet. We also still struggle to get clinicians to participate. Every year I send out invitations to a list of social workers, psychologists, etc., and nobody really comes on that space. So it just shows again that clinical and medical level manifestation there. So I use the opportunity at these events to present evidence around treatment and recovery and stigma, specifically stigmatizing language and improving mental health literacy. So as the recovery walk has grown, so has the media coverage over the years. So the evidence that I present at these events gets disseminated widely through the media, and you'll see here all these different media press releases about the recovery walk, really sharing that knowledge widely, or the information widely. So we'll play the video after the presentation. But what I want to say is that funding is a huge issue, even for the recovery movement, and we rely on small donations to our Back a Body campaign. And one of the things I'm responsible for is fundraising. So don't be surprised if you find an email with our Back a Body link in it shortly. So I look forward to helping others start up similar recovery movements in their cities and towns. So please reach out to me if you need any guidance or assistance on getting something like this started in your setting. So on an individual level, reducing stigma really starts with me. So I've made a tough decision to be open about my recovery. I educated myself. I've done the postgraduate diploma in addictions, public mental health. I'm currently doing a master's in public mental health. There's an African proverb that goes, until the lion learns to write, his story will always be told by the hunter. And that I find to be so true, because I need to educate myself to be able to explain to people what substance use is about, what is mental health literacy, what is addiction, what is stigma, how it impacts people. And if I want to influence anything on a higher level than just myself, I need to also understand the language and speak the language of academics, speak the language of these policymakers, speak the language so that people can understand me, because it doesn't, like, I need to be able to write my own story, because until I do that, my story will always be told by others. It will always be told by the journalists in the media. It will always be told by the academics in the papers that they write. It will always be told by others, you know. And until I learn, or until I educate myself and write my own story, that's so important. So through my personal recovery journey, I've learned to be very reflective, self-aware, and open-minded. I always try to focus on the similarities and not the differences in people. I'm passionate about sharing knowledge, like the TV show, the Recovery Walk, and community engagements. So being supportive and being that guide on the side, that empathetic ear, is really foundational to who I am. So the importance of inclusivity and diversity is of utmost importance to me, because those community stakeholders who discriminate and are stigmatized, those are the people we need to bring into the fold, not exclude them because of the discrimination and stigmatization. So those are the people that I need to have conversations with. I found that in my personal recovery, having people with diverse opinions or diverse views actually leads to growth, you know, rather than having people who are like-minded, being surrounded with like-minded people. So it's really important for me to be inclusive of all people. And something I didn't mention on the slide was courage, and how important courage is. And courage is really the foundation of all of this, because it takes great courage to be open about my recovery. It takes great courage to seek further education despite the barriers for people in recovery. It takes great courage to be reflexive and looking within and all these things. So courage is really foundational, and people don't realize that whilst experience stigma can be short-lived. I can experience a stigma when I go to a clinician and they actually actively discriminate against me, and it can be quite short-lived. But the resulting internalized self-stigma, the endorsement of negative self-beliefs persists, sometimes for a lifetime, and it really leads to that self-sabotage that many people don't understand. So in closing, reducing stigma is definitely an inside job. Just like a drop falling into a pool of water, when I'm reflective and aware of my own biases, stigma, and prejudices, it has a ripple effect on my family, my community, and broader society's perceptions around substance use, reducing the stigma. I think we must always remember that every journalist, every clinician, every policymaker, every politician, etc., is just a person, part of a family and part of a community, who bring with them their cultural beliefs and attitudes. So when we change, the people around us change. So I've put on here the 3 questions we've posed in preparation for this presentation. But thank you so much for listening to me today. I'm not an expert or anything. I'm just a humble servant, and I'm honored to be able to share with you today. So thank you very much.
Warren, Warren, thank you for that incredibly uplifting presentation. And I love your saying that if you don't tell your own story, someone else will. And before we get into your questions, hold on one sec. I just have to confirm my speaking language. There we go. Before we get into some of your questions, I want to follow up on some very interesting things that your presentation articulated. Very much the same in the United States. We see that law enforcement plays a key role and can be key allies in our fight to reframe substance use issues as a public health issue and not as a criminal justice issue. When I heard law enforcement saying in the US that we need more treatment, not more arrests, I knew that we were making progress. So besides law enforcement, are there other key sectors that you've worked with or you see as really important allies in our effort to reduce stigma?
Michael, to be honest with you, there are many sectors. So it really, we need to grow a coalition, and I don't think government or local government representatives should be out of the picture, because, and that's what we're struggling with, is getting politicians or local government representatives involved in this. So that's been a struggle, and I think once we have that, we would make great strides. For example, because those kinds of people can then open doors for us to get to magistrates, which we struggle with. That's a door that I can't get open to reach magistrates, because once I can get when I can reach magistrates as well, it'll make a huge difference. Another key sector is the faith-based organizations, the religious sector, and they have a humongous role to play in the especially in our rural communities, because in South Africa, in our rural towns, you'll find that there might not be a library or a social worker or a psychologist. They might not see those people ever in their lives, but there will always be a huge church. Every small town has a massive church. They don't have a community center, they don't have a library, they don't have any services, but there's a big church in it. And that really, and that person who's responsible at that church, the priest or the pastor, whoever it is, his attitude and beliefs, it gets really disseminated amongst all his whole congregation, and if we can get to that person, we're halfway there, you know.
Great, thank you. I think your point about faith-based communities is right on target. We've seen them play a crucial role in other diseases, particularly other stigmatized diseases, and the walk that they play. Oh, I actually forgot part of what I was supposed to do today, and that was to finish with a video that Warren provided for their recovery walk. So let's play that now, and then we can go back to our discussion. Oh, that's great. Very inspirational, and love the music. It gets us all, for those of us who are here in the morning, it gets us all moving in the morning. One more question, Warren, that I want to follow up with you on. And, you know, you talked quite quite passionately about your own kind of personal disclosure and your recovery. And how have you seen, during my time with the Obama administration, I tried to use my position to be open about my recovery in a very public way, because I felt like that kind of personal knowledge goes a long way to reducing stigma. And maybe you can talk about kind of what you've seen when you disclose kind of your recovery. Have you seen people's attitudes change? Have you seen them kind of come around in terms of understanding a little bit better what addiction is? What's been the impact of your kind of coming out, if you will, on your about your recovery?
Yeah. Let me first tell you that I'm always very anxious before I come out to people about my recovery, especially like in professional settings, because stigma is still alive and stigma is still a thing. And I'm in the academic space, work related, and even in my professional life, it takes great courage actually just to be open about my my recovery. But I will say this, that it might not affect people's perceptions immediately, but it still takes a conversation, because when people look at me, they don't see somebody who has a drug problem or is in recovery from a substance use, you know what I mean, disorder. They don't see that. They see me as where I am at the moment. But it takes a conversation to remind them that just that the person that they envision as being this person on the street was also me. It was a different phase in my life, but it was different, but it's still me. And I've had that lived experience. And so everybody that they have this negative image that they have in their mind of a substance user has the potential to be who I am at the moment, you know, in recovery and so on. So, you know, we all at different stages of recovery. Some might not be where I'm at. Yeah, and it's our attitudes and our stigma and how and our acceptance of people that either makes or breaks them, you know, that can either be kind of contributing to their recovery or actually breaking them down.
Yeah, great. So I'm going to ask you one more question, and then we'll open it up. So I think those of us who are in positions where we can use our own recovery to try to change attitudes, it can be very frightening. It can be challenging. And it does take an amount of courage. So how do you get your own, where does your own support come from? I think how we support each other is particularly important. But so how do you get your own support to continue to do this work and continue to be public about your recovery?
So Michael, I'm part of a 12-step fellowship. That's where I found my recovery. I seek recovery or seek treatment many years ago, but I was unable to afford treatment. There were no publicly available treatment, and actually the ones that were, it was a waiting list of 4 months before you could actually get this treatment. And in that time, and so I never ever been to treatment in my life. I just walk through the doors of a 12-step program, and that's where you'll find me every Saturday afternoon at my home group, and that's where I get my support from. And after my anxiety of this presentation today, I'm sure going to a meeting tonight as well. so that's kind of my support. People don't understand, but in that, I didn't want to speak about that, but even in that settings, I often share about the language we use, because we use an internal language, an insider language in these 12-step fellowships that we can't use to our families, and we shouldn't be using it because it really perpetuates the stigma. And so we need to be careful about, or mindful about the language we use. It's fine to speak internally, in our closed group, but not outside, and using that kind of terminology and language. So that's where I get my support from.
That's great. Thank you. That's good to hear. And I think your point about being very careful that we not use our insider language in a public setting, I think is very important. And how we talk to one another and what we call one another is different. And we have kind of permission, if you will, to use some of those terms that we shouldn't be using in public settings. So thank you very much. So I want to open it up now to people who might have comments or questions about Warren's presentation. I think all of us in recovery have probably experienced stigma at one point in our lives. And many of us are doing work to combat that stigma. So I want to open it up to people who have comments or questions. Warren, I think, posed a few questions to us about how people in their own lives have experienced stigma and kind of what work they're doing to combat it. So with that, I'll open it up to see if people have questions or comments. So please raise your hand so we can kind of acknowledge you and turn on your microphone. So Ashwin, I'm going to put you on the spot here and just ask for your reactions and your thoughts and maybe your personal experience around this issue.
Right. I mean, the one thing that really caught my attention, when you said, Warren, the self-disclosure, it can be challenging sometimes. It requires a lot of courage. But I particularly like what you mentioned earlier, and this reminds me of what Dr. Robert Dupont said, who's also here today in our first dialogue, that addiction is a very unique disease because there is this transformation and inner transformation where when people get better, you see this huge shift. And what really occurred to me was when you said that when you disclose about your recovery journey, people get to see before when you were struggling on the streets versus now. I think my perspective or my experience of being in recovery, I don't know whether it's because I just purposely turn a blind eye or whether I feel maybe I'm a little bit more fortunate, but I don't really feel that stigma when I share about, being in recovery. I don't feel like, people are discriminating or stigmatizing against me. Yeah, to me, that's been my experience. Or maybe I'm just a little bit thick-skinned. It doesn't really bother me as much, or I don't focus on that. But maybe in my early years, my early recovery, I was a little bit more conscious about it. I was always afraid that, or maybe someone's going to sort of think of me as a lesser person. But in my experience, I've noticed that people just, so you're in recovery. Okay, great. So what else? And it seems to be people accept it as something that I've done, part of the journey of my life. And I think what's important is sometimes people sort of look at us for what we are doing now and, the person that we are now. So that's really been my experience of disclosing my own recovery journey. Yeah.
Great. Thank you. Mariano, I see that you have your hand up. So please go ahead.
Sí. Can I speak in Spanish? You can put in your gloves because we are going to use the
I believe so. Let's this is the first time we're doing it, so let's test it out.
Ok, muchas gracias. Díganme si está escuchando la interpretación en inglés. ¿Se escucha bien? Muy bien. Muchas gracias, Warren. Muchas gracias. Y muchas gracias, Michael. Muy interesante, pero quiero de alguna manera hacer una pequeña pregunta y un comentario. Entendí, Warren, que una muy buena estrategia es unir la recuperación a la prevención, porque cuando unimos a la prevención la recuperación y no solo la recuperación al tratamiento, cuando vamos a la prevención, vamos a la población general. Y cuando estamos con la población general, lo que queremos es que la población general, que es la mayoría que no consume drogas y que no quiere que la gente consuma drogas, queremos que entiendan este fenómeno, que es un fenómeno de salud, que es una situación de salud. Pero tenemos que, la gran mayoría no quiere la normalización del consumo, porque la gran mayoría no está de acuerdo con consumir drogas. Pero lo que sí podemos trabajar es la humanización de las personas que han tenido el problema del consumo de drogas. Y creo que la humanización es un tema que se puede trabajar como lo estás trabajando tú, Warren. Entonces, mi primera pregunta es, ¿cómo ves tú la vinculación entre la recuperación y la prevención? Si eso es estratégico para bajar el estigma. Esa es una de las primeras cosas. Y lo otro, que tenemos que lograr que las personas puedan humanizar este fenómeno, porque también tenemos que pensar cómo la sociedad se protege cuando un usuario de drogas problemático cambia el comportamiento y agrede a la sociedad, agrede a la familia, agrede a la comunidad, y la comunidad se defiende de esto, pero se defiende con estigma. Entonces, tenemos que lograr cambiar eso porque tienen buenas razones la sociedad para defenderse, pero nosotros tenemos buenas razones para humanizar el fenómeno para que la integración social y la recuperación sea efectiva. ¿Qué piensan de esta reflexión? Esa es mi pregunta. Muchas gracias.
Can I go ahead and answer?
Please.
So it was quite I think Siva got everything that you were saying. So about prevention and recovery, I think the continuum of care is often seen as quite linear, but it's actually circular, and recovery and prevention overlaps because you'll find the determinants or risk factors in substance use disorders. If we can sort that out in the early stages, that is actually prevention. That's prevention work. Building on protective factors and reducing risk factors. So in South African context, you'll find the determinants for substance use are really on a community level is unemployment, housing, just generally the same as probably all around the world. So we need to focus on those things. You'll find recovery capital, the elements of recovery capital, it's being social and all these other elements, it's preventative as well. So recovery and prevention does go hand in hand. You'll find it a strong overlap between the two, and I totally agree with you with that, where that's concerned. The other question that you asked me was about, I can't remember what was the last question you mentioned. Dang, I had it in my mind. Does anybody remember that last question at the end of his?
But I think you also asked, and you sort of answered that, the link between prevention and recovery. Yeah, and
I think Mariano also underscored kind of your comments about humanizing the humanizing recovery and how kind of critical that is. Let me follow up on that, because I think we all know, for those of us in recovery, there are better ways to talk about our recovery, to telling our story. So how do you work with other people in recovery in terms of training for them to do public speaking and to talk about their recovery journey?
Is there a question you're posing to me?
Yes, or
Yeah,
anybody.
So personally, I really try to inform people and use the education that I have and informing other people about substance use, because I often find people in recovery, whatever pathway that led them to recovery is kind of what they think is the best approach to recovery, and they share that openly and widely with everybody, and it's being the only pathway to recovery. And so really opening people's minds about the different pathways to recovery, and being open-minded about that, and sharing your perspective, and making sure that when people understand this is only your experience and your pathway that you've chosen for your recovery, and just informing people on language, really, because when people do these dialogues, and you often find in South African context, we will find, this is again prevention, so people like school settings would get somebody who was found in recovery, and it's often a through religious or faith-based means or whatever, and they would be the school principal would ever get this person in to say what their pathway was, and it's always in the situation in South Africa, it's really like a religious pathway, and so we need to be open-minded and know that there's various pathways to recovery.
Warren, your presentation also kind of articulated kind of how stigma manifests itself with both the media in terms of how they frame kind of stories and people with addiction, often as criminal behavior or in very stigmatizing ways, and also at the medical level, and some of your frustration in kind of the lack of interest of the medical community in looking at this issue. And for those people on the call, I wonder if anybody has done work in those areas, either working with the media or working with the medical community to educate them around issues of addiction, and to try to diminish some of the stigma from both the media and the medical level. So does anyone have any experience or stories they'd like to share? Junjun, you have your hand up. It's good to see you.
Yeah, hi, Mark. Good to see you guys. Good evening and good morning. Yeah, I live here in the mountains in Baguio, and when I was new here, a challenge was getting the message of recovery or even treatment, because of the terrain and the mountains and the roads and all of that. So we partnered with the Catholic Church. They had a radio station, and every Saturday, we would guest either a family member or a person in recovery to tell their story, and then we'd have a Q&A from the audience. But mostly people who called were the family members. You know, I actually had one client that came in a few years later and said that he listened to me every Saturday, and he was cursing me, you know, but he listened. You know, then he came in. He was a medical professional, so that was our way of battling stigma. I even but we got canceled a few years later, after a while, because I started cursing the late the former president, so we were banned. But that was our way of we would talk about the 12 steps, one step at a time, and also basically recovery and the family stories, even about actually have family dialogues with their so-called SUD, PSUD on air. So start talking about it, bringing it out. And that was our way of, and then giving out phone numbers, although that wasn't a good idea because we started getting a lot of I started getting a lot of weird calls, you know. So I would like to continue that again, because it was a way of getting, there were so many stories, I had them on tape, especially from family members, you know. It was very, how would you say, transformational. That's all. Oh yeah, I just wanted to thank Warren about that self-disclosure. That was an interesting point. That that kind of tickled me a bit because I've always been open about my own addiction, about being in recovery, but I didn't really understand that sometimes I may be enabling the stigma more by talking about that in that kind of language outside of our circle. So thank you for that.
Great. Thank you, Junjun. Junjun, you've raised an interesting issue, and Warren, you talked about this as well, and that's the role of families, right? So we know that stigma often is very pervasive in families in terms of them getting help for themselves. So can you talk about maybe some of the work that you're doing with families, or if others on the call, Landry, I think you mentioned your work at Burkina Faso around family work. So let's talk about the families a little bit and kind of what we can do to help destigmatize this and provide families with their support. Want to talk about some of those things? Go ahead, Warren. You can start.
Oh, I thought we were going to give somebody else a turn. So my work with families really, in my daily life, I really work with school settings and community organizations. So in a previous role, many years ago, I did work with families, and but really the families of people who use substances. So people who are seeking help for either a spouse or a child or somebody who's using substances, and they don't really, they're at the what's in, they don't know what to do about the situation. And those are the only interactions that I really have with educating families. But it's, yeah, it's something that I haven't been doing over the past while. So I think that I would be better place to give somebody else opportunity to speak about their work with families.
Great. Anybody else like to talk about that or ask another question or raise any other comment?
So we have a question. Sammy's got a question for Warren. He asked, between stigmatizing actions and words, which one do you feel has somehow changed among the law enforcement people? Yeah.
I think it's a bit of both. I think that law enforcement are now more aware of the words that they use and the actions. So this whole thing with speaking to community stakeholders, which include law enforcement, is really connecting dots for them, because we speak about stigmatizing language, but for the ordinary person, they can't connect the dot between how their words affect what's happening in their communities. You know what I'm saying? There's a complete disconnect. So we can speak about you using stigmatizing language, and these are the correct terminologies. But actually, if we don't have a conversation and connect dots for people, they'll never understand how their language impacts other people. Because substance use in South Africa, specifically in Cape Town, is really a dire situation where people are struggling. It's like a knock-on, it's a catch-22 kind of situation where there's really a huge impact in terms of crime and all the consequences of substance use, but that consequences only came about because of stigma. So people are not seeking help early in the journey or prevention or all these other factors and determinants. So the substance use carries on for much longer than it ought to, and the people at the end of their road in terms of their addiction journey. And all these negative things are happening in communities, and which further perpetuates the stigma. But what I'm getting at is that people can't see how the words that they use has any part to play in all of that happening. And so that's quite a conversation that we have with community members as well as law enforcement. So it's about having those conversations, and the conversation that I did have has a huge impact on their being able to see the bigger picture and how stigma or the way that they behave or act, their actions, and also the words that they use in not only in their professional lives, but also in their home lives as well as in the communities that they live. Yeah.
Thank you, Warren. I see that my good friend and longtime pioneer in the field, Dr. Bob DuPont, has joined us. He's been a great supporter of our network and these dialogues. Dr. DuPont, we're talking about stigma today and how we think about reducing stigma. And, I wonder if you could give us some reflections on both kind of how stigma manifests itself, but also successful strategies that you've seen in terms of reducing stigma. We've talked about the role of personal narrative and self-disclosure can play. We've talked about working with allies in the faith-based community and the law enforcement community can play a pivotal role. But I am sure you have many, many reflections on this topic.
Thank you, Michael. I'm so proud to be with you in this group. My heart is just swelling with gratitude for what you're doing and how you're doing it globally. I wanted to share a story about myself. I was a graduate of the Harvard Medical School and leader in this field and all this. And I had my practice of my own. I had a patient I was seeing, and he looked at me one day and he said, doctor, I don't think you really get it. I said, what do you mean I don't get it? I'm an expert in this thing. He said, I don't think you understand what recovery is. He laid it out for me, what it was. This is 20 years into my practice, 20 years that I didn't know that. The line I use is addiction is a teacher. Addiction is a teacher. It teaches everybody. It teaches the addicted person. It teaches the families. It teaches the others. It even teaches the doctors. Is what I have said. And the other thing I want to just mention, I feel really strongly about, is that the person in the addiction is a different person from the person in recovery. It is not the same person. And that is really important to understand that. There's I don't call it a spiritual growth, character growth in recovery that is very specific and very wonderful. I mentioned that one of the studies that I did that was very important to me was looking at how physicians in America are treated for addiction. And we did the first study, national study of that. And one of the things we did was follow up 5 years after they completed the program. And we asked them, what was the most important thing to you in your recovery? This is 5 years after they were in recovery. And the answer was treatment was high in regard to that, but twice as high as treatment was 12-step programs. That's American physicians. They rated twice as high the 12 steps as they did treatment, and the treatment was very high. Now, we're talking about a revolution in thinking here. And the leaders in this thinking are the people in recovery. And those stories are inspiring. And they change the whole discussion when you do that. So I think that's very important. I think that to talk about stigma, a lot of the things that active addicts do deserve stigma. They are reprehensible things. You don't really want to avoid that. But what's wonderful about it, even the person with the most despicable background can be incredibly wonderful, positive person in recovery. That miracle is what we're selling, that process to do that. And I just think what you're doing it globally, which is extremely important to do that, to link people together in this miracle of recovery and announcing it and spreading it and explaining it like that patient did to me all those years ago. And I'm just very proud to be part of this process, thanks to you, Michael.
Yeah. Thanks to a lot of people on this call. Well, yeah, as we say in recovery, we don't do it alone. But let me ask you a question. You raised kind of your lack of training in medical school on addiction, and you actually learned from patients. And I think probably everyone on this call who's in recovery has experienced, and Warren talked about this in his presentation, a significant amount of kind of stigma and discrimination within the medical community.
Sure.
So have you seen changes within the medical community?
Oh,
as
not
it
nearly
relates-
enough. Not nearly enough. I'm as frustrated today about the medical community as I was 30 years ago. It drives me crazy. They don't have any idea what recovery is. Honest to God, they don't have any idea what recovery is.
So other than our own personal disclosure to our physicians, I feel very similarly in I've been in recovery a long time. I've had many physicians, and I have really yet to meet a physician who really understands my recovery, and have felt like I get frustrated feeling like I need to be the teacher. So what should be our strategies? Let's focus on solutions here. How other than our own personal disclosure and personal teachings, what do you think we need to do to accelerate change within the medical community to diminish the stigma that many of us feel?
The doctors are slow learners. It is a big challenge. And it is not going to be easy because they think they have the answers. I'm sympathetic with them. I thought I had the answers all that 20 years, and they just don't know. And I think that you keep on keeping on is all I can think about. But bring it up with the doctors. Talk to them about it, and tell your story like Warren did. Every story is inspiring. Every single story is different, and every single story is inspiring. And keep going with that. Get the doctors to come to meetings. That was a big deal for me to go to a meeting. I didn't go to a meeting for all those years, and then I did, and you can feel it. It's beyond just sort of a study or something like that. It's a power that is there. One of the things that I say to people, I'm very proud to be an American for a lot of reasons, but one of the top reasons is what happened in Akron, Ohio. It was the founding of AA, which was just 9 months before my birth. AA was founded. So AA is 9 months older than me, but I didn't know about it at that time. But I'm proud of AA and its globalness and its openness to any culture, to any person, and what that inspiration is, and the wisdom that is available. No cost, no training, no bureaucracy, just people helping each other. That's inspiring to me and unique. So I want to get doctors to go to some meetings. That's what I'd like to do.
That's great. Dr. DuPont, you never fail to inspire. And I want to raise, many of us have talked about the importance of kind of personal self-disclosure, but many of us in 12-step programs who found our recovery through 12-step programs have often viewed the tradition of anonymity in 12-step programs as a reason to not disclose, despite the fact that the founders of AA were very public about their addiction and recovery. So I wonder if anybody on the call has a reaction to that, or have felt that because of their membership in a 12-step program, that somehow inhibits them from their own personal disclosure. Warren or others, I don't know if people want to comment on that.
Yeah,
I'm going
so
to have to get off, but thank you very much for doing this.
Dr. DuPont, thank you for joining us. I promise you that Dr. DuPont has already agreed to be part of the Global Recovery Network and will be participating in some events in the future. So
I'm looking forward to it.
We're excited about it. I think he is a tremendous example of how you kind of keep the kind of passion alive and have an enduring career. So we should all be so lucky, and we're very lucky to have him. Thank you, Dr.
88 years old.
I know. Look at that, right? Thank you.
Thank you, Michael. Bye-bye. Thank you all.
Bye.
I think Anne wants to say something.
Hello. Landry, I know your mic is not working, but I just want to encourage people to look at your comments in the chat in terms of some of the work that you're doing, so people can see some of the things that you've been doing here. Anne, you have your hand up?
Yeah. Can you hear me?
Yes.
Oh, okay. I did the 12-step recovery program in a rehabilitation center, and that was 19 years ago. And I was the only female client in the rehabilitation center. So what I tend to think is that people will not, the anonymity part is because of the stigma that people went through during the drinking days, that, when you come now as AA members, you don't want the outside world to know, because you fear to be stigmatized more, because stigma is still there even in recovery. Because I remember the first time I did a TV show and I said, I'm in recovery 3 years. My auntie called me and said, why are you shaming us even more? You ashamed us when you're drinking, now you. So she even said, I don't even trust that you're sober. So I recover loudly. So I talk a lot about my recovery to encourage people to seek treatment, seek professional help. And I'm happy that I'm in this forum, and I look forward to meeting nearly all of you in Greece.
Yes, I think we all do that. Yeah. And I want to follow up. I want to follow up on your comment. Particularly, when you came into 12-step program, being the only woman, right? So
yes,
how do you see the how do you diminish some of the enhanced stigma that many of us in marginalized groups can often feel, right? So not only do you have the additional stigma of having had an addiction, but being a woman, being an LGBT person, there can often be kind of this intersectionality, if you will, but with other stigma. So how have you dealt with that as a woman in recovery?
Sorry. First of all, I made a decision when I was still in the rehab that when I come out, I want to reach out to as many women as possible. The real reason for me going public through the media was for I wanted people to know that even women can get addicted, that addiction cuts across the board. No, being an African was even worse for me, because an African woman is supposed to be a caregiver, a nurturer, a person who brings the family together. And here you are drinking, abandoning the children, and everybody looked at me as a failure. So I wanted people to know that this is a disease, you can go for treatment, and this is doable, recovery is possible. And that is basically what I've been doing, and more so reaching out to women, especially like now here in Kenya, we have women in the commercial sex industry, and nobody is bothered about such women. I will reach out to them, I talk to them, they formed a group. I also reach out to women in the public transport industry, truck drivers and conductors and all. They have a special group. So I reach out to them because they're also suffering from alcohol and drug abuse menace. So those are some of the groups that I'm reaching out to, because actually addiction being a shame-based disease, and people in addiction are mostly very misunderstood population. So people do not understand us. And then, so if you don't understand yourself, then you lose hope in life. So I go and share my real life experience. I share with them where they can get the AA support groups where they can get Al-Anon support groups, where they can get a COA, Alatin. Yeah, because we have all those kind of support groups. Yeah, that's what I'm doing currently.
Great. Thank you, Anne. I think we're a little bit over time here. So I want to just offer Warren or Ashwin any opportunity for kind of final comments here on a kind of what's been a very engaging discussion today. So Warren, do you want to say any final comments?
Yeah, I just want to thank you for the opportunity. It was such a pleasure just sharing my experience with everybody. Look, there was so much content. I had to cut down quite a bit to save time. But these are conversations that needs to be ongoing. For example, the role culture plays in stigma, and these finer nuances that really make up the topic of stigma. But yeah, it's a start to a further dialogue, I suppose. Eh?
That's great.
And we were speaking about those faith-based organizations that have a huge footprint in South Africa. And one of the things that I'd want to be doing is really disseminating this recovery curriculum to the rural towns in South Africa. And I'm hoping I can do that soon. Thanks.
Great. Thank you. Warren, I want to thank you very much for your presentation. I want to thank Ashwin and Nancy Dudley, who couldn't be on the call today, for not only being kind of great participants in the Global Recovery Network, but putting together these dialogues. I also want to introduce Pravita, if she could wave. If you're getting great newsletters and flyers about the dialogue, that's because of Pravita. We are fortunate she is part of ISSUP's communication team, who's actually working with us at the Global Recovery Network. I'll just wrap by saying thank you to everybody to be on the call today. We will send out a summary and a recording of the call to everyone who's on it and to other participants in the network. So thank you all for being here today. I know personally this was a very engaging and uplifting presentation and conversation that we had today. So keep up the great work, everybody. And continue to support each other on this journey. So thank you, everybody.
Bye, everyone. See you next month.